Your Imperial Highness, honorable guests, colleagues, and friends, I am privileged to be part of the launch of this 51st Union World Conference on Lung Health. The theme, Advancing Prevention, really must be a call to action in these days of global pandemics. And we really are talking about converging pandemics here. COVID-19, HIV, TB. Even before COVID-19, TB remains the leading cause of death for people living with HIV. We're not doing enough to find active TB among people living with HIV, missing half the HIV-TB cases each year, and we've really only started to do enough to prevent TB among people living with HIV. And then comes COVID-19. Threats of service interruption for HIV and TB are very, very real. We've already seen them. Modeling with UNAIDS and WHO projects that a 6-month interruption in HIV treatment alone in sub-Saharan Africa could lead to massive losses of lives, 500,000 additional deaths, bringing us back to 2008 levels. We could lose a decade of progress in just 1 year. And so we can't let COVID-19 be an insurmountable hurdle to progress and preventing TB and HIV. After all, we've been overcoming hurdles together for decades. For example, even when multiple studies proved the safety and effectiveness of TB preventive therapy, or TPT, when WHO promoted TPT since 2004, it took decades to overcome health workers and community doubts and to mobilize funding for TPT. And now we've seen progress reaching 1 million people living with HIV on TPT in 2016 and 17, and now 3.5 million people in 2019. Now's not the time to slow down. With COVID-19, the world is now seeing the impact of the hurdles we've only partially overcome over the years. Hurdles to fully achieving hospital infection control and health worker safety, despite clear WHO guidelines and interventions like TB basics to rapidly transform settings. Hurdles to capacity for contact tracing, too few investments in human resources and technologies needed to do it right. And only now do we hear more leaders talking about the challenges of the built environment to prevention. Crowded spaces, lack of light and ventilation, challenges to cough hygiene, things the TB community has known since early in the last century. So I challenge all of us to not lose momentum during this challenging COVID time, but instead to team up and shout loudly, now more than ever, for aggressive investment in these colliding epidemics, in preventive therapy, infection control, health worker safety, scaled modern contact tracing, built environments, and the social and economic supports that people need. To do that successfully, we need communities. Community-led organizations of people affected working for people affected by HIV and TB. Community-led organizations at the governance and policy tables, providing services, and also being watchdogs to verify that what's been promised is actually being delivered. And to do that, they need to be directly financed and fully equipped. Overcoming COVID-19, TB, HIV, and future pandemics requires global solidarity. Together we must develop and equitably distribute combination prevention, treatment, and vaccines to all. True access that prioritizes those who need it most. So thank you, and I wish you all a powerful conference.